The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
It is a therapy that will prolong their life and give them a better quality of life.
A groundbreaking procedure for those once who had little hope. A new procedure for those once deemed too risky for surgery, and it's at Rex Hospital. Good afternoon and welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today's show is of real importance for everyone watching, whether online or in front of your TV today. We're focusing on heart health. It's Heart Month, and sadly, we all know somebody who's had heart disease or stroke. After all, heart disease is the leading cause of death in the United States. So today, we're spending our time talking about how to keep your heart healthy. If you're watching us live now and you have questions concerning heart health, our operators are standing by to take your calls. Your questions may be answered here live on our program by our experts. The experts answering your questions today are cardiologist Dr. George Adams with Wake Heart Vascular Specialist and Dr. Gregory Rose with Wake Heart Vascular. To reach us here at Rex on Call, just dial the number on your screen right there. It's in Wake County 919-744-3876, and outside of Wake County, call toll-free 877-277-6252. If you're watching us as we stream live on WRAL.com, you can email us your questions. Go to WRAL.com and search Rex on Call. You can even find us on Twitter. Send us a message at Rex on Call. And while you're calling in with those questions, take a look. Right here, this is a tiny groundbreaking device. It's new to the market, and a team of surgeons at Rex Hospital has been handpicked to perform this monumental surgery.
This is the Edward Sapien pericardial TAVR valve.
That's a really long name for a very small and groundbreaking device. TAVR, for short, is giving hope to patients once deemed inoperable because of aortic stenosis. Here's Rex's Dr. Lance Landvater with Rex Cardiothoracic Surgery Specialist. He's one of the few approved cardiothoracic surgeons hand-selected to implant this device.
Patients in their 80s, and by the FDA rules, they're only patients that we declare inoperable. In other words, a surgeon has to see that patient and say they are too high risk to tolerate an open surgical procedure. And as a result, they become a candidate for a less invasive procedure.
Here's what happens in the TAVR procedure. Instead of surgically opening the chest, the valve contracts and is inserted through a guide wire inserted through the femoral artery in the thigh. Again, here's Dr. Landvater.
What they're going to show here is passing a guide wire through the femoral artery, through the aorta, and it's going to pass through the valve. Now they're passing a balloon up, and it will go through the valve, and they will balloon dilate that valve. So they'll pop the valve open. Now they'll pass through the TAVR valve, and as you can see, it's working immediately. The leaflets are opening and closing.
And there you have it. The valve, which rests in a stainless steel frame, adheres to the existing calcification. No sewing, non-invasive.
It is a therapy that will prolong their life and give them a better quality of life.
Not only is the device innovative, so is the team approach behind the procedure. It takes a hand-selected and specially trained team of doctors that in most settings don't work side by side.
So it really is an exciting concept. It involves a merger of cardiac surgery with cardiology, and the parent institution has to be very much involved and committed to this, as we are here at Rex.
And joining us now are cardiologist Dr. George Adams and Dr. Gregory Rose. We actually got a handful of questions online before the show even started, so let's start with those. Dr. Rose, this is from Kristen. She was diagnosed at age 16 with mitral valve prolapse. She's now 44 and she's had to take antibiotics before any dental work or any surgery. Does she still need to do that?
Well, the guidelines have recently been changed to suggest that she doesn't need to. it seems that the risk of complications or side effects from the antibiotics is much higher than the risk of infection. So now they've recommended that it's not necessarily routine to take antibiotics.
Okay, good information. Okay, this one's from Linda in Raleigh. She read recently online that if she was having chest pain, that person should never lie down. She recently has had pain in her mid-sternum and got up before she went back to bed. Is that correct?
So, Kim, that hits on a couple very important points. First, she's a woman. So in terms of chest pain in dealing with the heart, women typically have atypical symptoms. So pain radiating to the jaw, radiating down to the abdomen, to the back, etc., rather than typical chest pain. So that's first and foremost. The second is when someone has chest pain, the three most common reasons are that of your heart, your GI system, or musculoskeletal chest pain. So we really can't differentiate what that would be with her. So I would err on the side of caution in that she should contact a medical professional to decide whether that would be a typical type of heart symptom for her.
Okay, but should she be lying down if she has that when she's sleeping?
So obviously I would not lie down.
Okay.
If she continues to have pain, I would not take an aspirin and lie down.
Okay.
I would discuss this with a medical professional before doing such.
Okay, good advice. This one is from George. He had inverted T waves in his EKG. He found this out years ago when taking a physical for a military flight training program. He would like to know what caused that.
Inverted T waves can be a normal variant. Perimenopausal females may have inverted T waves in the certain leads. It obviously occurred many years ago, and it was probably just normal for him.
So it's normal?
It may be normal. If there is a change from a previous EKG where your T waves are normal and now they're inverted, that may suggest a cardiac illness and may warrant further evaluation.
And if someone has an electrocardiogram, they should have a copy of their electrocardiogram such that the medical professional evaluating them will have something to compare to.
Okay.
Because if it is an old finding, then we are not as concerned.
Okay. This one is from Linda. She received a drug-eluting coronary stent in 2009 for partially blocked circumflex. She hasn't had any trouble since, but she's on Plavix and wants to know how long she needs to be keeping to take the Plavix.
So that's a common question. So the circumflex artery, it goes around to the left side of your heart. And commonly we do putting drug-eluting stents. It helps prevent that reclosure of that stent. Plavix helps us prevent the reclosure of that stent, and current recommendations indicate that we should keep it for at least 12 months. Now, should it be longer than 12 months? We don't know the answer to that, but at least 12 months, as long as there is no bleeding risk. If she did have some sort of bleeding risk or emergency surgery, then we would change that recommendation.
Okay, so something that she needs to monitor with a doctor, obviously. Okay, so it may seem common sense, but if you think you're suffering from a heart attack, call 911. Believe it or not, there are some people that start having chest pains and they actually drive themselves to the hospital. Obviously, that could significantly delay treatment or even worse.
I think it's important to understand in a heart attack, minutes count. Without a doubt, if you're experiencing any kind of chest discomfort, whether it's pain, tightness, pressure, without a doubt, give us a call. Call 911. We can do a rapid assessment and try to help determine whether there's something significant going on. In addition to transferring that information to the hospital, we also carry a number of medications that may be necessary to get started in a timely manner, whether it's aspirin, nitroglycerin, other medications that deal with heart rhythm disturbances that may be important at that time. Cutting that time is so critical that it can actually prevent that heart attack from being a fatal heart attack. It can prevent a second heart attack as a result of what's going on in the first place, and it can help reduce strokes associated with that event as well.
What is our time frame for the time you think you might be having a heart attack to the time you receive treatment?
There's a saying that goes in cardiology that time is muscle. And a heart attack is when the heart muscle starts to die because it's not getting enough blood supply. From the time that the artery closes off, stopping the blood supply to the time the heart muscle dies is about 18 minutes. And heart attacks are usually complete in 4 to 6 hours. So as soon as someone is having chest discomfort and they're concerned that they're having a heart attack, they need to seek immediate evaluation.
But there are people that actually drive themselves to the hospital. That just baffled me, but it's apparently pretty common.
I have a patient that drove himself from the coast to come see me while he was having a heart attack. He and I had a long discussion about that prior to his discharge.
Yeah, I mean, texting while driving is one thing, but driving while a heart attack, that's completely another. Okay, well, after the break, we're going to talk about some signs and symptoms of peripheral artery disease. It's more common than you might think and can be an indicator of a more serious underlying problem. And as always, our operators are taking your questions for our experts. In Wake County, call 919-744-3876. Outside of Wake County, toll free, 877-277-6252. You can also email us your questions. Go to WRAL.com and search Rex on Call. Your question may be answered here live. Stay with us. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on how to keep your heart healthy. If you have questions for our experts, call the numbers on your screen. Email us your questions. Go to WRAL.com and search Rex on Call. Peripheral artery disease, or PAD, is a condition of the blood vessels that causes the arteries leading to the hands and feet to harden and narrow. Many times PAD will go undiagnosed because people might mistake it for symptoms of something else. But it's worth a simple trip to your doctor to find out if you have PAD.
The most common symptom of peripheral artery disease? Leg pain when walking. Dr. S. Wayne Smith, director of the Vascular Diagnostic Center at Rex, says those people are lucky because many don't even know they have PAD.
One of the problems with PAD is that half the patients don't have symptoms.
And if you don't have symptoms, you might not know that PAD can be an indicator of a more serious underlying problem.
When you find PAD, there's a high likelihood that you've got carotid or heart disease. So PAD in and of itself is not generally life-threatening, but it's a marker, a potent marker that you've got to have your heart checked and you've got to have the carotids checked.
So should you be checked? The answer is yes if you have a history of any of the following: high cholesterol, diabetes, heart disease, high blood pressure, obesity, or if you're a smoker over the age of 50. And everyone over the age of 70 should be screened regardless of medical history. Dr. Smith says there's no reason you shouldn't. It's so simple to find.
Comparing the blood pressure, the systolic pressure, the top pressure in the ankles to the pressure in the arms, and the pressure in the ankles should be at least as high as in the arms.
Dr. Smith says your primary care physician can refer you to his clinic if those numbers don't compare.
So our program is kind of unique in that we can identify the problem. If you're a good candidate for medical treatment and no intervention, we know how to do that. If you'd be better served with a balloon angioplasty or stent, we send you down the left lane. If you need an open surgical procedure, we could send you down the right lane. So it's a multidisciplinary approach and trying to put the disease with the right physician.
And all those physicians are right here.
Yeah.
Treatment for PAD can be as simple as diagnosis, from cholesterol-lowering medications to starting an exercise program. In some cases, angioplasty or bypass surgery may be recommended. Now, Dr. Adams, this is a focus of yours, and you see this as part of the bigger picture.
It is part of the bigger picture, Kim, and the reason I say that is when you look at your body's sort of the house. Inside the house is the plumbing. If you get a blockage in one part of your plumbing, whether it be in your legs, your heart, or your vessel supplying your brain, you're at risk of getting blockages in other parts of your plumbing. For example, if you took 10 people that had significant blockages in their legs, 7 of those people would have a significant blockage in one of their heart vessels, either now or in the past. 3 of those people would have a blockage in their blood vessels leading to their brain, either now or in the past. So how do you treat it? You treat vascular disease the same. So as Wayne Smith just said a second ago, diabetes, cholesterol, blood pressure, stopping smoking. I can't do much to help you with increasing in age or your genetics right now, but the other 4 we address strongly.
Okay, so it's worth getting checked out. Now we have questions here that are actually related that I wouldn't have guessed. Paula and Robert, the female caller wants to know the warning signs of a heart attack in a female, and a diabetic wants to know the warning signs of a heart attack. And you say these are related.
They are sort of related, and the reason they're related is a lot of times the symptoms that these two groups specifically have, and these two groups being women and diabetics, have atypical symptoms. So as alluded to earlier, the jaw pain or the belly pain or the back pain or radiation down the right arm instead of the left arm need to be taken seriously in these two groups of people. Additionally, specifically with the diabetics, they may not have symptoms typical of, as alluded to earlier, but they may not have any symptoms. It may be passing out or something of that sort.
Okay, DJ in Raleigh wants to know, how does smoking contribute to coronary artery disease?
Well, smoking does several things. First of all, the carbon monoxide and the nicotine do damage to the blood vessels. Cigarette smoking is associated with lowering of good cholesterol levels, which are protective against heart disease. So I have a saying I tell my patients before they leave the hospital. I tell them to keep smoking. It's good for business. And I think they get the idea on that, that they need to stop.
Okay, Helen from Goldsboro, a mitral valve has a slow leak. What does that mean?
A slow leak means the mitral valve leaflets don't come together to prevent backflow of blood. And the mitral valve regurgitation or leaking is well tolerated for many, many years, but after a long time, especially if the amount of regurgitation or leaking is severe, then it can cause the heart to wear out and the heart can enlarge, and sometimes it won't even get better after surgery. So that needs to be kept a close watch on by echocardiograms and examinations.
Okay, this is Monica. What causes an enlarged heart, and what can you do to help treat this?
Well, there are several things that can cause an enlarged heart. First and foremost, having a heart attack can cause an enlarged heart. Other things, you can be genetically predisposed to developing a enlarged heart. Stress on the heart, we especially see it in women of a young age, or in Asian women, called Takotsubo's, or metabolic abnormalities.
Okay, now this is from Gary. A stent put in an artery, is that a heart attack?
No, not necessarily. We do place stents in arteries during treatment of a heart attack, but a patient may be having symptoms of ischemia or poor blood flow without having damage, and so a stent can be placed to enlarge that lumen of that blood vessel to alleviate the ischemia, and a stent can be put in just to help symptoms even without any damage.
Okay, thank you very much. Okay, coming up, we're going to answer more of your questions. We got a lot of them to go through. In Wake County, call 919-744-3876. I'm trying to say these fast. In Wake County, 877-277-6252. Email us your questions. Go to WRAL.com and search Rex on Call. Welcome back to Rex on Call, live from the WRAL studios and streaming live on WRAL.com. To reach us here at Rex on Call, dial 919-744-3876 in Wake County. Outside of Wake County, call toll-free 877-277-6252. Email us your questions at WRAL.com. You can just search Rex on Call. We're taking questions for Dr. George Adams and Dr. Gregory Rose. Okay, some of those questions that came in online. When I go to bed at night, I have a fluttering in my chest that beats really hard. I'm a 57-year-old female. A lot of stress but no pain. Should she be concerned? This is from Connie.
I think that's something that needs to be evaluated by her doctor. It may just be that she's under stress and her heart's beating hard, but it could be an arrhythmia, and that can be evaluated with possibly electrocardiograms or arrhythmia monitoring devices like a Holter monitor.
But easy to diagnose?
Relatively easy to diagnose with a monitor, but it needs to be checked.
Okay. This one also online. Can a female have a heart attack without having chest pain? That one's from Sandy in Durham.
Absolutely, she could. So not your typical symptoms. Again, if she were ever to have jaw pain, problems laying flat, problems waking up at night, short of breath, unexplained passing out, unexplained acute swelling in her legs. But the answer to the question is yes.
So scary. Yeah.
The Framingham data says that they took a large population of people in Framingham and looked at their EKGs every year. 16% of those people had a heart attack based on their EKG that was totally asymptomatic. So it's possible.
Okay, this one's from Linda. Recently had both valves replaced, a bicuspid aortic valve replaced. If they fail or need replacement, can she have a prosthetic valve? Any takers on this question?
I would imagine she could. Literally, the prosthetic valve, as you showed your earrings earlier, are a nice ring that would go in between the valves, and it's much like a self-expanding stent that, when deployed, crushes the valves open and then replaces a new valve in place of it. Greg, do you have any other comments?
No. Since she did have the valves replaced, she already has a prosthetic valve in, and the question is, can she have another prosthetic valve? And if she's health is good enough, she could have another surgical valve.
Okay. But that's up to her doctor to...
Right.
Okay. Now, as a way to encourage folks in the Triangle to know your risk of heart disease, Rex is offering a $5 Applebee's gift card for everyone who completes a HeartAware Internet assessment this month. Go to uncrexheartaware.com and take the quick online assessment. I took it. It took like 5 minutes. Then they'll send you a $5 Applebee's gift card while supplies last. If you answer a series of questions about heart and family history and get a personalized report on your heart health, people with high risk factors can get a free screening at Rex or UNC hospitals. Stay with us. We have another round of questions when we come back. Welcome back to Rex on Call. We are taking a final round of your questions about heart health. Let's get right to it. This is Renee in Durham. Her mom has 4 stents. She's on Plavix. She has zero energy, vomiting, weakness, shortness of breath. Has the stent collapsed?
It's possible it could have collapsed. It could be side effects from some of the medications. That's something that needs to be reevaluated by her physician.
Okay. In 2006, there was 6 of cardiac, coronary stents. Her legs stay cold, and could the leg coldness be a problem with her legs, or is it a problem with her heart?
It's a great question. So again, we know she's had stents in her heart. Could she have peripheral arterial disease as well? because it's a general picture, absolutely. In terms of coldness in the feet and the hands, typically just cold feet and cold hands don't mean peripheral arterial disease. It just means you have cold feet or cold hands. But if your shins are cold or your arms are cold, that's more indicative. But again, I would follow up with a vascular specialist and have those studies as Wayne Smith mentioned earlier.
Okay, this is Gladys from Mount Olive. She has shortness of breath. How does she exercise without shortness of breath? She wants to start an exercise routine, but can't catch her breath. How does she do that?
Well, if she has a significant amount of risk factors, she probably should see her physician to have stress testing to make sure that it's safe for her to exercise. And then she could enroll in a program such as the Rex Health Center and do supervised exercise to make sure that she's not overstepping her bounds.
Absolutely. Okay, this one's from Billy. How often should I have a nuclear stress test conducted?
So in terms of diagnostic testing, especially for a nuclear stress test, when people have symptoms. So if they have recurrent bouts of chest pain or those symptoms we've discussed already and previously, then that's when I would get another nuclear stress test. The only caveat to that is if they had a heart attack and they didn't have symptoms, such as the 17% of people, as Greg Rose described to earlier, then that would be a person that I may do a stress test on, even in lieu of them not having symptoms, such as the diabetic.
With changes in healthcare and reimbursement, we are somewhat limited in doing nuclear stress testing. Now the recommendations and guidelines are nuclear stress testing every other year.
Okay. Well, as always, consult with your physician about any health concern you may be having. Thank you very much, Dr. Adams, Dr. Rose, and thanks over to the phone bank. They've been very busy. Now, next month, we'll be discussing colon health with our experts. That's Monday, March 19th at 1, right here at WRAL. Email us your questions ahead of time. Go to WRAL.com and search Rex on Call. We will see you next time. Thanks for joining us.